Lauren, I don't know what the number is. 60% want to be vaccinated. Maybe I saw a better statistic, 68, 69%. What's the number one way to get that percentage up?
I think we have to get more vaccine into arms so that people see that this is a safe and effective vaccine. That's probably the number one thing. And then number two is to build better access points. So as people see that they can access the vaccine easier, they're probably more likely to want it as well. So we have to build that trust that we've been talking about all along, but we also have to make sure that as the trust is being built, we give people the path to access the vaccine.
Are we going to see companies actually distributing the vaccine themselves, given the fact that that might be or has been proposed as one of the most effective ways to distribute the inoculations?
I think as we move out of this emergency phase and into the sort of broader phase of vaccinating the entire population, not just our most vulnerable or most critical people like healthcare workers, for example, we will explore so many new options for how we distribute vaccines. So if we see that something's not working, we can move on to, if a mass vaccination site is not really getting people through in a way that's safe and effective, then we look at other strategies like going with companies. We can also look to getting vaccines to local healthcare providers, trusted community healthcare spots. All different, community access points should be explored.
Lauren, when do you think the free-for-all, so to speak, begins, given the rate we're at right now?
I think in the next few months, we're going to start to see a situation where as vaccine supply increases, we get to the point where people can really start to access it. Anyone who wants it can start to access it. I think the concern right now for a lot of people in vaccine distribution is that we'll get to a point where the people who are having a hard time accessing it continue to have that hard time and eventually give up. So we want to make sure that as we're building that trust in the community, that we're also expanding the access points to be as equitable as possible.
These are brilliant numbers, 2.16 million. We were at 900K when President Biden took the White House, and we've accelerated since then. I just wonder whether we need additional vaccines in this country, Lauren, and how we should distribute individual vaccines at the moment. We have J&J, Moderna, Pfizer, and we're north of 2 million, and the supply chain looks good. How do you think about that challenge at the moment, whether to take on AstraZeneca as well and others too?
Yeah, I think the more vaccines we can get into utilization, the better. Globally, we want to see broad spread of the different vaccine types. The supply chain for some of them can make that challenging, but at the same time, we don't want to be in a situation where we're only distributing one in one location and a different one in another. We want that coverage. There's different benefits to the different types of vaccines. Different populations may desire certain vaccines. So anything we can do to broadly expand the coverage with different types of vaccine, better.
Lauren, I look at all the years we have of Farm Aid and other We Are the World, all the different charitable things, and it's all celebrity driven in America. We all know that. I have been absolutely thunderstruck that, for example, Pfizer doesn't go out and get 20 different celebrities, Tom Brady, Beyonce, John Farrow, and the others, and just line up 20 celebrities to say, look, it's not going to kill you. Have you been surprised that we haven't done that?
I think that this was talked about early. I think we'll start to see that as vaccine becomes more readily available in the first, in the first amount of time that we've been trying to distribute right now, where we're really targeting those most vulnerable populations and the highest risk groups. It's really been important that every vaccine goes into the arm of someone who needs it so desperately, right? So any vaccine that goes to a celebrity is a vaccine that doesn't go into a healthcare worker or an elderly individual. And for right now, I am totally comfortable with that strategy. I completely understand. And I think that ultimately that is exactly what we'll see. We need community members, we need trusted celebrities, we need vocal people who are willing to show that these vaccines, when they go into people's arms, are safe and effective, and sort of live their lives in the spotlight so people can actually see that. But I think there's no pathway to give people those vaccines that doesn't create inequity for right now. So I have a feeling that will be the wave of the future, but I think for right now, it's right that we haven't seen that.
And by the way, Tom Keene was trying to throw it off to John Farrow that he was going to be the celebrity poster child. However, Tom Keene is quietly submitting his own name for that role. There is a question. Tony Fauci said over the weekend when Face the Nation that he was looking to health officials to release guidelines on post-vaccination behavior imminently. The idea, can you go out? Do you have a free-for-all? And can you live life again? What do you expect those guidelines to be?
I expect that those guidelines will be sort of focused around the next safe step, right? So can you see your grandparents? Can you expand your bubble a bit to other people who've been vaccinated? Can you safely eat in a restaurant? And just like increasing your sort of zone of comfort. I think I do hear that they're eminent. I think we need them desperately, because when people have guidance, they tend to follow that guidance. But when there's no guidance, it's like everyone is making those decisions individually. And that's what we don't want to see. We want to see a clear path to reopening, almost like a roadmap that people can follow. And when you have the map, it's certainly easier to follow it. And when you don't have the map, it's way easier to get lost. And right now, as cases are sort of plateauing, we don't want lost people wandering around.